Hello, and welcome to Women Speak, a production of the Women's Resource Center in Wayne. I'm your host, Mojdeh Keykhah, and each month I focus on a topic that is of interest to women and the people they care for. This interview is being conducted via Zoom during the Coronavirus Crisis 2020 on MLTV Mainline Network. Today, Women Speak is happy to have psychologist Paula Durlofsky, who will be discussing stress, couples, relationships during COVID-19. Paula Durlofsky, PhD, is a licensed psychologist with a private practice in Bryn Mawr. As a practicing therapist for over 18 years and the winner of Best Therapist in 2017's Best of the Main Line Awards, Dr. Durlofsky helps individuals, couples, and families reach their full potential for leading lives with passion and purpose. She is also affiliated with Bryn Mawr Hospital, Lankenau Medical Center, Psychoanalytic Center of Philadelphia, and our own Women's Resource Center. She has a new book coming out titled Logged In and Stressed Out: How Social Media is Affecting Your Mental Health and What You Can Do About It. Dr. Durlofsky's expert opinions, based on over 2 decades of clinical experience and training, have been featured in Marie Claire, Teen Vogue, American Psychological Association's Monitor on Psychology, Exceptional Parenting Magazine, Mainline Health, Psych Central, and Mainline Today, as well as at the Pennsylvania Conference for Women and on ABC 10 KX TV. Paula, I am excited and honored that you are joining Women Speak today.
Thank you, and thank you for having me. I'm really happy to be here.
There has been a lot of discussion in the press about the stressors and stress that couples are facing now during COVID-19. Can you tell us more about what you've been seeing with regards to couple stress during this time?
Yeah, in regards to the stress that we're all feeling, like, will I still have my job, my health? What if my partner gets sick? What if an elderly parent gets sick? Couples are also feeling their own unique set of stressors. It is interesting because there are some couples that I'm hearing that are saying that the time has been nice and that they've actually gotten closer. And then there are other couples that for the first time ever, one of their partners is drinking more alcohol than normal or is feeling really depressed, something that they hadn't had prior to the pandemic. And they can't get out of bed or help with the household chores or childcare. And then, of course, there's the other couple that I'm hearing from and that I'm seeing that prior to the pandemic, they were having a significant amount of problems. And now their problems are worse. They're fighting more often. The fights are becoming much more destructive. And they're really worried, will they come out of this intact? Can they make it through the pandemic?
Yes, you mentioned about the intensity of arguments going forward during the pandemic. I just wanted to mention that the Women's Resource Center has a community resources webpage that describes and discusses the available domestic violence hotlines in the region for those that would need that.
Yeah, very, very important.
So what can couples do to help their relationship during times of high stress and COVID especially?
Well, the first thing that couples can do is to work on not making things worse. And, that's in and of itself is a huge step towards progress. So one way that couples can do this is to generate a list as to why you wouldn't want to make things worse. And when we know the why, that really helps with the how. So for instance, your list could include that you notice that when you have these types of conflicts with your partner, that you feel more sad, you feel more lonely. It creates so much distance between you and your partner. And another thing that I think is really important for couples to do that they can do right now is when we're in those moments, the heated moments where we have conflicts with our partner, it's really hard for us to keep in mind the good things that our partner does for us. So that's another thing that couples can do that can help them to not make things worse is when they're, of course, not angry, to generate a list of things that they really appreciate and love about their partner. And that's something that they can also read on a daily basis that can help them not slide into more destructive and emotional interchanges, which, is very hard to come back from. And another thing that couples can do right away now is to work on stepping away from negative interactions. And this, of course, does not mean that you're surrendering or saying to your partner that you're right, but rather to think about this as an act of self-care and self-love, that when you're not engaging further in a volley of verbal attacks, that's a way for you to take care of yourself. So learning how to end conflicts, more on like a neutral note. And one way you could do that is to practice saying to your partner, why don't we come back to this? Or let's take a break, or to physically walk out of the room.
That's right. We have a chance to cool ourselves down and to literally be more calm in this situation by doing some of the things you suggested. I also want...
And to really see that as a form of self-care and self-love rather than as a weakness. And I think that that's really important. So this kind of goes back to, well, what can we do to not make things worse? And I want to add is to work on being able to truly appreciate how much having these kinds of conflicts hurt you individually.
I think also there's the temporal aspect that this has been going on now for about 6 months with no definitive end, and perhaps that's creating some stressor points. And I was wondering, what are some of these stressor points that couples are dealing with?
Yeah, that's a really good question. And, I would have to say that I think probably one's own mental health, even for the best of us, those that are pretty healthy. This is a really hard time and everybody's being tested. But I want to say that something that couples can really do for them, for their relationship and for themselves, is to work on their own mental health. Some of us, our constitutions are just more easygoing, and for others, we're more sensitive. And more sensitive people tend to have bigger reactions. That's okay. It's not a judgment. It's just what it is. But being aware of this is so important and can be so helpful for you. So, learning ways within a couple that you can, take care of your own personal mental health is so important. Ultimately, we can't depend on our partner to do this for us, even when they do and say things that we have every reason to be angry with them for. We still have to take responsibility for our own mental health. So one way that you can work on this now is to figure out what forms of self-soothing self-care practices could help you lower your internal temperatures. That could be something like listening to music, drinking tea, exercising, yoga, meditation. But the important thing is taking the time to work on this and finding what works. And when you do, making sure that you do it every day. Because taking care of yourself is taking care of your relationship.
That's an excellent point. And something that you also mentioned was fantastic was that the differentiated personalities that we have.
Yeah.
People are different and they react to stress differently. What can you say for that?
And within the couple, when one partner becomes very emotional, oftentimes the other partner does. So they then become this regulated unit. And as I'm saying, it's very, very hard for anyone to work themselves out of that emotional state and be able to then access our logical and wise minds, which is when we're more able to pull back to hear what our other partner is actually saying versus hearing it from an emotional reactive stance, which oftentimes for all of us, we're not reading the signals right, which continues the arguments and the conflicts and more work to come back from.
I think you had mentioned in an earlier conversation with me that the COVID-19 pandemic is to be viewed more as a marathon, not as a sprint. And what would couples be well advised to do if they thought of it more as a marathon?
Yeah, and the way that I think of it too personally is that to be really conscious of how much energy, mental energy too, every day I'm putting out there, because it's really important to have fuel in our reserve, because we don't know when this is going to end. And again, it goes back to self-care.
Mm-hmm.
So taking time, plan time to rest, to do things that you enjoy, time where you can recharge, whether it's reading a book, watching TV, listening to music, anything that helps you recharge.
We didn't bring up the topic of children and the schooling systems that are going virtual or hybrid at the moment. Could you speak to couples that may have children and what they could do together to reduce tension in the household?
Yeah, look, for everyone, this is the first time, it's not like anybody has done this before. So they are creating a whole new roadmap. And I would say that if couples could sit down and really speak to one another about their needs and how to split, childcare and house and responsibilities for the home, and to really kind of work on being very open with one another about the need for self-compassion and that they are in it together, that this is something that they're going to be doing as a unit. Something that high conflict couples, I want to say, have oftentimes issues with, that they don't feel that their partner is on their side. So they end up doing a lot of activities on their own, which creates more distance. So fostering the concept and to encourage and to support that you're a couple can go a very long way.
Yes, that group approach or team approach to a problem always brings about better outcomes than people feeling isolated and not supported in a relationship, for sure. We spoke about children, and that brings us to the topic of social media and this stressful time. What is the role of social media during COVID-19, and what can be done to alleviate any stresses coming from that?
Yeah, that's a really good question, and something that I talk about in my book too is, social media has its positives and its negatives. And, something that high conflict couples may do is somebody may use social media as a way to self medicate, you know, negative feelings or to avoid a conflict. And that's never really turns out well. So, social media can be used in much the same way somebody would turn to food or turn to alcohol. And the data shows us that passively scrolling on social media, moment by moment, only ends up making us feel worse than we had moments or prior before we logged on. So, social media in this form is never a good option for, filling time or to use if we're bored, or as I said, if we're trying to self medicate a negative feeling. It's a great thing to use if you're going to socialize and interact with friends and family and, booster and build those relationships. So, going back to the importance of each person within the couple being mindful in every day of working on their mental health, being mindful of the way they use social media is the way that we take care of our mental health in today's world. So I tell people to really notice how often they log on, how long they're on social media for, how they feel after and during, and to be mindful of limiting their social media use and to recognize that that could be one of the issues that is creating the conflict for their relationship.
That's an interesting point. Having a set time limit on social media use instead of sliding into a longer period where one is almost unawares of the time slipping by is very important for mental health and also for couples health, so
Yeah.
that they respect the time spent with the couple, with the other person, and with their family.
Right. And that it's going back to another form of self care, that being on social media as a means of filling time is not self care.
Well, related to that, could you give us some specific solutions couples could implement right now during this uncertain time?
Yeah, absolutely. So, as I was saying, something that high conflict couples struggle with is seeing themselves as a couple. So, something that couples can do right now is to generate a list of things they can do together, which supports the concept that they are a couple. So, it could be something like going for a walk, listening to music together, binging on a Netflix series. Um, of course, not to focus on like a big ticket item right now, like travel, but something that they can really do every day right now. And again, that reinforces the fact that they are a couple. And another thing that couples can start to work on right now is to start to get into the habit of letting their partner know what's on their mind, of getting to know their partners on a more intimate level, and you sharing with your partner your more intimate thoughts. So, something just, every day getting into the habit of saying or sharing with your partner what you're thinking. what you're feeling, and to make sure that you show interest in your partner. These are all ways in which we can be with our partner too, with our guards down. So we're then interacting and we're connecting in a positive way and in positive ways that foster empathy and compassion and feelings of belonging. The other thing I want to say is doing things that you both like means that you are doing and you are engaging in a shared experience. And that is so important too for deepening our relationships and our attachments. So it's like super glue. Something you want to focus on is, adding more super glue to your relationships.
To continue with that metaphor, thank you for those bonding experiences that you gave examples of. How can couples use this time at home to advantage?
Yeah. That's a great question. And what can we do? And it is interesting because some people have been saying that although this is a very, very stressful time, there are parts of it where they're not rushing out the door, having to, get to the office or rushing kids out of the door. So that there's a part of their day that feels a little less stressful. And I think that with that in mind, this would be a great time for you as a couple to work on cultivating gratitude. And together, maybe starting each day with a list of 5 things that you as a couple can be grateful for. And, I would say a big thing, that I know I'm really grateful for right now as a couple is that my husband and I are both healthy. That we have a roof over our heads, that we, have beautiful trees to look at. When there's a sunny day, I'm really grateful. So as a couple, generating a list that you can start with every day reading. And when we cultivate gratitude, studies show that we're happier, we're less likely to be depressed or to compare ourselves to other people. So there's a lot of benefits to working on being grateful. And the other thing that gratitude helps us cultivate is a sense of balanced perspective. And when we have this, we're less critical of ourselves and we're less critical of our spouse, which again is going to result in less conflict. All positive. And finally, I want to say it's also a good time to get help from a mental health professional. We are still doing work virtually and when it's safe, even in the office. So that it's, that's always a good option.
Yes, especially now since we have telehealth possibilities, there's no barrier to connecting with mental health professionals if you feel that is needed. In the case of couples and in the case of individuals.
Yeah.
Finally, I'd like to ask you a question about isolation. There are people who are in a bubble right now. And what can you advise them on isolating, not being so isolated in this time that requires isolation sometimes?
So this is where I think to be really mindful of how social media can be helpful. And to keep in mind that socializing is good. When we're with people, whether virtually or in person, interacting, that's going to boost our mood. So being very mindful of using social media in an interactive way and upping it by using FaceTime, sending videos when you're texting, picking up the phone, calling people. And if you feel comfortable, actually seeing people in person, of course, with proper social distancing and masks.
Thank you so much, Paula, for sharing your knowledge, expertise, and experience with us today.
Thank you for having me.
Absolutely. The Women's Resource Center is also grateful for your volunteering your time to bring us this important information. Did you have contact information for people if they wanted to get in touch with you?
Yes, I do. People can find me at my website, which is www.drpauladurlofsky.com. drpauladurlofsky.com.
Thank you. To our viewers, thank you for watching Women Speak. I look forward to bringing you more in-depth conversations. For more information about WRC's programs and services, please visit www.womensresourcecenter.net.